Here are examples in medicine where substances beneficial in moderation can cause harm in excess. Number 1. Oxygen toxicity. While oxygen is essential for survival, excessive oxygen can lead to oxidative damage, lung collapse, seizures, and retinal detachment, especially during hyperbaric oxygen therapy or prolonged supplemental oxygen use. Number 2. Vitamin A. Toxicity. Vitamin A supports vision and immunity, but excessive intake can cause liver damage, bone pain, and neurological symptoms. Number 3. Iron overload, wherein is vital for oxygen transport, but excess iron in hemochromatosis damages organs like the liver and heart. Or corticosteroids. These reduce inflammation, but prolonged use can cause osteoporosis, diabetes, and adrenal suppression. Case presentation patient. Emma, a 7-year-old girl presenting complaint. Shortness of breath, worsening cough, and intermittent chest pain. History. Emma was admitted to the PICU for severe pneumonia requiring oxygen therapy. She has been on high-flow oxygen, FiO2 equals 0.80, for the past 72 hours. Despite improvement in her respiratory rate and oxygen saturation, she now complains of chest discomfort and persistent coughing. Her past medical history is significant for mild asthma. There is no history of prior PICU admissions. Clinical question 1. What is the most likely explanation for Emma's current symptoms? 1. Atelectasis from prolonged bed rest. 2. Pulmonary oxygen toxicity. 3. Acute asthma exacerbation. 4. Bacterial superinfection. Correct answer. 2. Pulmonary oxygen toxicity. Explanation. Emma's prolonged exposure to high FiO2, 0.80 for 72 hours, has likely overwhelmed her antioxidant defense mechanisms, leading to the formation of reactive oxygen species, ROS. The ROS cause oxidative damage to alveolar cells, resulting in symptoms such as cough, chest pain, and impaired gas exchange. Clinical question 2. Which pathophysiological mechanism contributes to oxygen toxicity in this case? 1. Dehydration of airway mucosa. 2. Increased production of reactive oxygen species, ROS. 3. Impaired ventilation perfusion, VQ, matching. 4. Surfactant overproduction. Answer 2. Increased production of reactive oxygen species, ROS. Explanation. High FiO2 increases the formation of ROS, such as superoxide anions, hydroxyl radicals, and hydrogen peroxide. These cause oxidative injury to proteins, lipids, and DNA, leading to loss of alveolar capillary membrane integrity, pulmonary edema, and impaired compliance. Management steps. What should be the immediate step in Emma's management? 1. Increase FiO2 to maintain SpO2, 9.8%. 2. Reduce FiO2 gradually to achieve SpO2, 92 to 96%. 3. Start systemic steroids to reduce inflammation. 4. Initiate bronchodilator therapy. Correct answer 2. Reduce FiO2 gradually to achieve SpO2 92 to 96%. Explanation. Prolonged exposure to high FiO2 is the primary cause of oxygen toxicity. Gradually reducing FiO2 to the lowest level that maintains adequate oxygenation helps limit further ROS production. Targeting SpO2 levels of 92 to 96% is adequate for most PICU patients. Clinical question 3. Which of the following would help mitigate the risk of oxygen toxicity in EMA? 1. Supplementation with antioxidants, e.g. vitamin C, vitamin E. 2. Keeping FiO2 around 0.50 whenever possible. Yes, regularly reassessing the need for oxygen therapy. 4. All of the above. Correct answer 4. All of the above. Explanation. Antioxidants help neutralize ROS, reducing oxidative stress. Limiting FiO2 to 0.50 whenever feasible minimizes ROS production. Regular reassessment ensures oxygen therapy is titrated appropriately to avoid unnecessary exposure.